Hi, I'm Meg Callahan with Infectious Disease Special Edition, and I'm here at CROI 2026 with Renee Heffron, who is a professor at UAB. And you gave a talk yesterday about implementation science. And my first question for you is, what is implementation science?
That's a good question. So it's a newer science than what we're used to seeing. It's only been sort of formalized for about 20 years. So things are still evolving, and people are still learning what it is. It's really about it's a science. So we're designing research questions so we can really answer questions about how do we deliver things that we know work better. And so sometimes we see that we'll have a new ART regimen or a new PrEP regimen, and it works in a clinical trial. It works great, but then it's not getting out to people. And so implementation science helps us unpack first why, and then try out different strategies that might get it out to people who need it most, faster, better, and in ways that help them sustain its use. And so, it helps us be more efficient with delivery, more precise, more cost effective, and all of those kinds of things.
So what are some of those barriers that you found between like the randomized control trials and the real world?
Yeah. So a lot of times it's things like access. People can't get to a clinic, or don't live in a situation they can keep medicines at home. So that's one of the things. And so we have all of these studies looking at delivering PrEP in particular, like from a mobile van. I showed pictures of a study in South Africa looking at that, or in pharmacies, or in a community setting, like using a library, or like a convenient place for people to go to for access. Other things are like adherence challenges, especially with daily oral PrEP. And so there in implementation science, you study like, well, how do you integrate daily oral PrEP with services that people are already having, like, or with like mental health services, so they can, so that those don't get in the way of people taking pills, or with substance use services, that you can simultaneously you can reduce the barriers to PrEP use and support adherence. So those are some of the main things. And so implementation science helps us decide, like, this is a better way to do it, or actually this way isn't better at all, and so we should keep looking for other avenues to improve access and adherence.
Do you have an example of one of those that maybe it was something that they thought would be a way to implement it and it didn't really work out?
I do. Actually, a study that we did in Kenya last year, and wrapped up last year. We were working in post-abortion clinics.
Okay.
And we wanted to work in that setting because it's a reproductive health setting. People have just had a very a meaningful event, right? And they've needed post-abortion care. And so we thought it might be one of those teachable moments when we could add in conversation about HIV prevention and PrEP. And so we did that, and we saw some uptake, some people starting PrEP from the post-abortion clinic, but then very, very little refills happening, right? And so it might be a good setting to talk with people about PrEP and kind of give them knowledge about it, but it's not a place that people really want to come back to. And so in terms of like that follow-up care, those clinics weren't ideal for that.
That's interesting. Maybe of the opposite, could you find an example of something that really worked?
Yeah. So actually just last week, the Latitude study was published, and that was from the ACTG network, and delivered injectable ART to people who were not virally suppressed. All the trials are done, these sort of switch trials for ART, so they're virally suppressed, they're doing well, and they switch them to a new regimen to see if they maintain viral suppression. But with Latitude, they actually reached the most vulnerable people who are not doing well on ART. And that trial had tremendous results showing that, yes, they do suppress on injections faster than they would have with the regular oral regimens. I think a lot of people are new to implementation science. It's with where we are with the epidemic, we still need new products. There's still a role for new products, for sure. And there's still a role for cure research and vaccine research, for sure. But I think we also have powerful products. And so if people want to learn more about implementation science and how they can do it, or to think about designing a study to answer an implementation science question, there's lots of resources. I put them in the last slide of my talk. There's like the NIH is funding consultation hubs around the country, and people can reach out to them for ours we do like drop-in office hours once a month, or we host seminars and workshops, and it's a way that people can access this science.
Very cool. And we could share some of that too.
Yeah, absolutely.
Well, thank you so much for taking the time to talk to us.
You're welcome. Thanks for inviting me.
Don't forget to like and subscribe so you can catch everything from Infectious Disease Special Edition.